Good evening. I wanted to thank Amanda and Stuart for inviting me to speak again. Today I'm going to talk about how a plant-based diet can prevent and improve autoimmune diseases such as rheumatoid arthritis and inflammatory bowel disease. I'm Chan Hwang, and I practice in Tacoma and Puyallup primarily, and looking to start a practice also in Federal Way. There's an increasing body of evidence that shows that the diet has a significant role to play in the pathogenesis of autoimmune disease, and vegan diets can actually protect against autoimmune disease. As mentioned before, the Adventists are a very interesting group to study because you are pretty much guaranteed a control for tobacco, control for alcohol, and many of the causes of disease, chronic disease. However, even though they are encouraged to be vegetarians, there's a wide variety of dietary practices, and so you can really be able to tease out what role diet has in disease pathogenesis. And they found that hypothyroidism, which is known to be autoimmune in many cases, is linked to a non-vegan diet. So in other words, if you look at vegan Adventists, they do not get hypothyroid diseases, but vegetarian Adventists are not thus protected. So it's very interesting how the vegan diet is seen to be superior. Next slide, please. Now, rheumatoid arthritis is a condition that I see more, although I refer to my rheumatology colleagues. And it's quite painful and very debilitating. And what we do is to try to rehab people with this. And because there are so many side effects with current treatments, they try to use alternative and complementary therapies in trying to help themselves. And the prevalence in non-vegetarians is greater than in vegetarians. Now, as with many autoimmune diseases, we think that there's some sort of hereditary predisposition, but then there's also an environmental trigger. And it seems that in rheumatoid arthritis, the trigger, at least one of the triggers, could be Proteus mirabilis infection. And what the body does is when you have an infection, it produces the antibodies, which apparently cross-reacts and starts affecting and attacking synovium. Next slide. So if we look at treating, in addition to medications, rheumatoid arthritis with a vegetarian diet, we see symptomatic improvement of joint swelling, pain score, grip strength, decreased morning stiffness, with less duration and less limitation in function. And there's also fewer swollen joints and fewer tender joints, as well as decreased Ritchie's articular index. A vegetarian diet can improve leukocyte count, IgM, rheumatoid factor, and complements, which can be destructive of the synovium. Erythrocyte sedimentation rate, which is sort of a nonspecific marker of inflammation. C-reactive protein is actually a ring-shaped pentameric protein that reacts with lysophosphatidylcholine, and it produces a series of reactions that activates complement through C1q, and that is also decreased. So the things that destroy synovium is cooled down by use of vegetarian diet. And then also the Proteus mirabilis infection is also decreased in people who eat vegetarian diet. Another group of autoimmune phenomena that we can see, and it's seen primarily where there has been dietary westernization, such as in wealthy nations. And when you see nations that become westernized in a dietary way, they kind of eat like the standard American diet, SAD. There's increased animal protein intake as well as fat and sugar. Next slide. Now, Crohn's disease may subside with TPN, or total oral nutrition, but when the person starts eating regular food again, then oftentimes it flares up. So if we can somehow find out what it is that inflames the gut, then we can actually have a better handle on inflammatory bowel disease. A vegetarian diet, as mentioned before, decreases risk of Crohn's disease by 70% in young women and 80% in young men. Plant-based diet improves gut microbiome. So we're finding more and more about these microbiomes, and we see that plants are the type that encourages a shift towards a healthy gut flora, whereas things like animal fat, sugars, etc., things that are not really healthy for us, maybe some of the mechanism is because it shifts the microflora to the more pathogenic organisms. Polyphenols modulate inflammation because, and we hear about this like in chocolate has it and green tea, etc., but it can prevent or delay the progression of Crohn's disease because these reach higher concentrations in the gut than in other tissues. A 2-year interventional study showed that if you put somebody on a vegetarian diet, at the end of 1 year, they have remission. And that's pretty amazing, to be able to have 100% remission at 1 year. And then even after 2 years, 92 are still in remission. Whereas in the control group, they have 33% remission only. Now, we are very fortunate to be living in this time where we can have biological agents that can really alter the progression of rheumatoid arthritis, Crohn's disease, and other autoimmune diseases. And infliximab, as you know, is a monoclonal antibody against tumor necrosis factor. This is the antibody, the monoclonal antibody. And then these two molecules here are tumor necrosis factor. And TNF is a superfamily of proteins. They're type 2 transmembrane proteins that are released when a cell is dead or dying. And so if you're able to get rid of TNF, you can stop the inflammatory process. And so these new biologic agents are really, like for instance, infliximab. There's also adalimumab, natalimumab, and some other ones which are very hard to pronounce. These monoclonal antibodies, they average about $4,000 or $5,000 a month. A plant-based diet, there's no additional cost. In fact, plants in general are less expensive than meat. And so if you can see this kind of reduction and remission in Crohn's disease, it kind of makes sense to let your patients know, hey, you can get very similar results with plant-based diet. Now, some people will need both, of course. Thank you very much for your attention.